Hello, Mr. Bear. My name is Trisha and I'm with Respiratory Care. I've come in today to give you some medications that the doctor has ordered. Sounds like your COPD is kind of having an exacerbation or you're having worse symptoms, difficulty breathing and those things. So we're going to have you do some medications that target your lungs to get those symptoms a little bit better for you. So I'm going to start with getting your vital signs and then we'll give you some medication. I'm going to listen to your lungs and see how your air is moving through your lungs. Big deep breaths in for me. Good. Good. Very good. Now I'm going to listen to the front side of your lungs. Good. Very good. Now I'm just going to get a heart rate on you. Very good. Heart rate isn't too high. Get oxygen level of your blood with this little device on your finger here. Good. That's looking good. Okay, Mr. Bear, can I get your name and date of birth here? All right, we'll get your medication ready. So this one, have you ever used a nebulizer treatment before? You have. Okay, just on occasion. Okay, so for this one is what we call a short-acting medication. So this is going to go directly into your lungs. It's going to target those lungs and it's going to open your airways and make it a little bit easier for you to breathe. So I'm going to put this mask, it's going to go on your nose, over your nose and mouth, and we're going to just take some regular breaths. Every 3-4 breaths, take a big deep breath in for me, and this will take about 10 minutes to complete. If we can keep all my equipment together here. Okay, so right over your mouth and nose, we'll flip on that oxygen. Big deep breath for me. Just normal breathing with occasional deep breaths. Very good. Now I'm going to have you take a really big deep breath in, and as you're breathing out, then make yourself cough. Very good. You feel like that's helped a little bit? Get those airways open? Good. Easing your breathing a little bit. Okay. And then we're going to take another listen to those lung sounds to see how that worked. Big deep breath in for me. Very good. 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 Airways are moving a little better. Now I'm going to get your pulse again. Good, and then your oxygen level in your blood. So we're looking at your pulse because we don't want it to raise too much with that treatment, which it did not, and then we're looking at that oxygen level to make sure that that improved, and it did a little bit, so that's good. So with that short-acting medication, it's, like I said, short-term, so we're going to do that 4 times a day, and that one, like I said, relieves that shortness of breath a little quicker than some of the other medications, so that's going to work in about a half hour or so. Like I said, it can cause your heart rate to increase, can also cause some tremors a little bit, you'll notice, or maybe feeling nervous a little bit. You've had those before, shaking your head, yes, like you have. So if those things get worse, or you notice other things that don't make you feel very good, you start to get sick to your stomach, dizzy, we want you to let us know right away. Let the nurses know, and we can kind of maybe adjust medications. So the second medication I'm going to give you is a long-term medication. This is more of a maintenance therapy. So the first one was fast-acting. This one is longer term, going to maintain those open airways for you. So this is just an inhaler. There's medication within this little tube right here. This also goes directly to your lungs. So with this medication, an important thing before you use it is to shake it up and get that medication all mixed together so it's not sitting separate. It doesn't work quite as well. This is a spacer. This will get that medication into your lungs a little bit more than just using this alone. So we're going to take out this mouthpiece here, connect that, make sure that's got a good seal. Once we have that, you see that good seal there, then we'll take this mouthpiece off. So I'll have you blow all the air out you can of your lungs before we use this, and then we'll put your mouth around here and seal good. We're going to press down and breathe in at the same time. You're going to breathe in as much air as you can, nice and slow, big deep breath in. Hold your breath for 10 seconds, and then we'll move this away before you breathe out. Okay, are we ready? Take a big deep breath out. Seal your mouth. Big deep breath in as we push that. Hold your breath for 10 seconds and pull that away. This one we'll do 2 of these, but we don't want to do them back to back. We want to wait about a minute or so before we do the next one. Give that medication time to get deep down into the lungs. And like I said, this is more of a maintenance. So once we've used the short acting one, then we'll also use this one 4 times a day. So that we can maintain that. This might help with sometimes if you notice overnight you're coughing a lot or you're having more difficulty breathing through the nighttime. This will help with that. That'll kind of calm some of that down for you. So let's get some more vital signs after those treatments. Sounds first. Big deep breath in. Good. Good. Doing great. Very good. Get your pulse again. And then that oxygen level. Very good. So now with this one as well, this one can cause some other symptoms as well. This one you can get a cough or a dry mouth with that. That's typical. If they get too bothersome, be sure and let us know and we can maybe again adjust some medications for you. Do you have any questions about the medications for me? Okay, is there anything else I can get you before I step out? Okay, so you'll see me again, approximately 6 hours. Like I said, we're doing both of them 4 times a day, so I will see you again. Thank you, Mr. Bear.